In this lesson, we will do an analysis about collecting data on environmental health conditions. Environmental health conditions play a critical role in shaping the health outcomes of individuals and communities. For nurses conducting community health assessments, collecting data on environmental health conditions is essential to identify risks, address disparities, and promote healthier living environments. This process involves gathering information about physical, social, and economic factors that influence health, such as air and water quality, housing conditions, sanitation, and access to green spaces. Below is a detailed analysis of the importance, methods, and challenges of collecting data on environmental health conditions. Regarding the importance of collecting environmental health data, collecting environmental health data is crucial for identifying health risks like polluted air or contaminated water, which contribute to illnesses. It highlights disparities affecting vulnerable populations, guiding targeted interventions. Accurate data supports policy advocacy for improved conditions such as stricter pollution controls and promotes preventive care through strategies like education campaigns and community cleanups. This data-driven approach ensures healthier and more equitable environments. Key environmental health indicators include air quality pollutants like PM2.5 and ozone, water quality clean drinking water and contaminants, and sanitation proper sewage and waste disposal. Housing conditions such as mold and ventilation, and access to resources like healthcare and grocery stores are also vital. Additionally, climate factors including extreme weather events like floods or heat waves significantly impact community health and should be closely monitored. Nurses collect environmental health data through primary methods like observation, assessing housing or public spaces, surveys and interviews gathering community perceptions, and environmental sampling, analyzing air, water, or soil for pollutants. Secondary methods include using public health databases, e.g. 500, who reviewing community reports on local environmental conditions, and leveraging GIS mapping to visualize risks and resource distribution. Using these methods together gives a full picture of environmental health. Collecting environmental health data faces challenges like data gaps in secondary sources, which may be outdated or incomplete, and resource constraints as primary data collection requires time, expertise, and equipment. Engaging communities can be difficult, especially in underserved areas where trust may be lacking. Additionally, the complex interplay of environmental factors makes isolating specific causes or effects challenging, complicating accurate analysis and intervention efforts. To comprehensively assess environmental health conditions, nurses should integrate environmental data with methods like focus group discussions to understand community perspectives, health outcome data to identify correlations, e.g., between pollution and asthma, and social determinants of health to address disparities. For instance, combining air quality data, resident interviews, and health records can help pinpoint pollution sources and advocate for cleaner air policies. Nurses can utilize environmental health data in various ways to improve community well-being. They conduct community health assessments to identify risks like poor sanitation or air pollution, prioritize interventions, and educate communities on preventive actions, such as waste disposal or water filtration. Nurses also advocate for policies addressing environmental issues, like stricter industrial emission regulations, and use data for emergency preparedness, ensuring readiness for disasters like floods or hurricanes. Collecting data on environmental health conditions is a vital component of community health assessments, enabling nurses to identify risks, address disparities, and promote healthier environments. By using a combination of primary and secondary data collection methods, nurses can gather comprehensive information on key environmental indicators, such as air and water quality, sanitation, and housing conditions. Despite challenges like data gaps and resource constraints, integrating environmental data with other methods such as FGDs and health outcome analysis enhances the depth and validity of assessments. Ultimately, this data empowers nurses to design targeted interventions, advocate for policy changes, and improve the overall health and well-being of communities.